three. Hello, everyone. This is Tom. I'm here with Dr. Param Fagoora, board certified ophthalmologist, and this is Clear Vision Today. Dr. Fagoora, many people are asking, how often should I have eye exams?
This is a very good question for general public. People are not aware when and why and how often they should have their eyes checked. The general rule will depend on the age of the person and the conditions their family has been having in the past. Let's talk about the children first. The general rule is the baby at 6 months should be checked to ensure their eyes are working properly and they are seeing well with each eye. Caution, if you have a child up to the age of 6 months and the eyes are shaking, called nystagmus, he should be seen at the moment you see this condition. If the child has watery eyes, discharge, and redness of the eye should be seen at the time this condition starts. It's a good idea to talk to the pediatrician at that time, because most of the time pediatricians see these kids regularly and they can advise that yes, this child should be seen by an ophthalmologist. The next step in age for children is they should be seen around the age of 5 years before they enter kindergarten to ensure that they see well in the class and learn well. Now let's move to the older population. Most of the eye conditions are diagnosed by routine examination because eye conditions do not have symptoms. So patient does not know about them. The general rule is have your routine basic exam at the age of 40 years. That gives the ophthalmologist picture of your eyes to compare in the later years to diagnose some of the conditions, for example, glaucoma or macular degeneration. Now, if you have special conditions like diabetes, hypertension, rheumatoid arthritis, or symptoms of dry eye, you should be seen earlier than 40 years. Most of the time, your primary care doctor can advise you if you have these special conditions for the ophthalmological eye exam. If you injure your eye, or you splash chemicals, or you see blurred vision, floaters, flashes of light, and sudden loss of vision, you should be seen immediately by the ophthalmologist.
Excellent answers. So once a person who has an eye condition has been seen by an ophthalmologist, should they come in once a year or every 2 years?
After the age of 40 years, the recommendation is when you reach 50 years age, you should have an eye exam every 2 years. When you reach age of 65, you should exam every year, provided you do not have some special conditions. That would entail maybe examination more often.
Excellent answers, Dr. Fagoora. I just want our listeners to understand that an ophthalmologist is a medical doctor, and it's a board certified specialty, and they're not just optometrists who can do initial exams, but they're specialists in diseases of the eye and eye surgery, and that's the understanding we have with the answers we've received. I thank you so much for those very insightful answers.
You're welcome.